Welcome to the deep dive, where we sift through the complex stuff to bring you the knowledge that really matters.
hmm
Today, we're diving into a fascinating area of feline health, acromegaly in cats. Now, stick with us because this isn't just some obscure condition. It has a surprisingly strong connection to diabetes in our feline friends.
That's absolutely right. We've been looking at some detailed medical texts, and a key insight jumps out immediately. Acromegaly, which involves the body producing way too much growth hormone, might actually be a significant underlying factor in, well, a lot of diabetic cats.
Exactly, a really significant number. So our goal today is to cut through the medical jargon, and give you the essential information about acromegaly, what it is, how it shows up in cats, and why it's so important, especially if you're dealing with feline diabetes.
Right.
So let's get right to it. What exactly is acromegaly in cats?
Okay. At its core, it's a syndrome that happens when the anterior pituitary gland basically goes into overdrive. It produces an excessive amount of growth hormone. And this is often triggered by a non-cancerous tumor in that gland.
Oh, okay.
And this surplus of growth hormone then sets off a whole cascade of effects throughout the cat's body.
And these effects aren't all direct, are they? I mean, the sources talk about growth hormone having direct effects that are, what, catabolic and diabetogenic?
Yes.
But they also mention insulin-like growth factor I, or IGFI. What's the crucial difference there?
Yeah, that's a really important distinction to get your head around.
Right.
While growth hormone itself does have some direct actions, particularly in counteracting insulin's effects, that's the diabetogenic part.
Right, makes sense.
Many of the physical changes we actually observe are driven by IGFI.
Yeah.
The liver releases IGFI in response to those elevated growth hormone levels.
Oh.
And it's the IGFI that exerts those really potent anabolic, growth-promoting effects.
So growth hormone is like the trigger.
Exactly.
And IGFI is the main engine driving the physical stuff.
You got it. That's a good way to put it. IGFI is behind those visible changes.
Okay, so what kind of changes are we talking about then?
Yeah.
What does this excessive growth look like?
Well, imagine a general pattern of, excessive growth. Elevated IGFI leads to an overgrowth of soft tissues all over the body, potentially causing an increase in overall size.
Uh.
It also results in visceral organomegaly, that's just enlargement of internal organs.
Right, like liver, kidneys.
Yeah, affecting organs like the kidneys and liver most commonly. And interestingly, it also affects bone. It leads to remodeling and thickening, particularly noticeable in the skull and the paws.
The pause.
Yeah, and this can contribute to joint problems, arthropathy, a broadening of the facial features, and those distinctively enlarged, sometimes people call them clubbed paws.
Clubbed pause, that's a very descriptive term. And it's not just the pause and face, is it? The texts also touched on potential impacts on the heart. What's happening there?
Yes, myocardial hypertrophy, which is basically the thickening of the heart muscle, that can occur. However, and this is interesting, despite this thickening, actual heart failure is relatively uncommon in cats with acromegaly.
Oh, really?
Yeah, the reasons aren't entirely clear, but it's an important observation from the medical data we looked at.
Huh. Now, let's circle back to that really significant connection with diabetes. How exactly does this overproduction of growth hormone lead to diabetes in cats?
It really boils down to that insulin antagonism we mentioned.
Okay.
The excessive growth hormone interferes with how insulin normally works in the body. Over time, this constant opposition, this fight, can lead to the insulin-producing beta cells in the pancreas just getting exhausted.
Worn out.
Exactly. Worn out, eventually resulting in diabetes mellitus. And here's a really critical insight from our sources. A surprisingly high number, like 25 to 33%, of all diabetic cats may have acromegaly as the underlying cause.
Wow, that's up to a third.
It's huge, yeah.
So if the acromegaly can be addressed, if those growth hormone levels come back down, does that mean the diabetes might actually get better or even go away?
Absolutely. The medical text suggests that, much like with other causes of diabetes in cats, there's definitely a potential for diabetic remission if the overproduction of growth hormone can be effectively managed.
Right.
This is particularly true if the diabetes hasn't been present for, a super long time. It really highlights why getting an early and accurate diagnosis is just so critical.
Definitely.
Mm.
So who is most likely to develop acromegaly? Are there certain age groups or types of cats that are more susceptible?
The data we have indicates that it primarily affects middle-aged to older cats. The median age is around 11 years.
Okay.
But, it can occur in a broader age range, say from about 6 to 17 years old.
Right.
And quite strikingly, there's a very strong male predisposition. Approximately 80% of diagnosed cases are male cats.
80%. Wow.
Yeah, it's a really significant skew towards males. That definitely stands out in the research.
That's a very clear trend. Now, if someone at home is listening and have a cat, or maybe a veterinary professional is tuning in, what are the initial signs? What might make them suspect acromegaly? What should they be looking for?
Well, in the early stages, the signs often just look like typical poorly regulated diabetes.
Okay.
So you might see increased urination polyuria, increased thirst polydipsia, and often a noticeably increased appetite, polyphagia.
Right, the classic diabetes signs.
Exactly.
Yeah.
However, the sources also note that while an increased appetite is common, some cats might paradoxically present with weight loss as well, probably due to the underlying diabetes itself not being controlled.
That makes sense. The diabetes itself can cause weight loss. But the texts really hammered home a key, almost counterintuitive sign that should raise a red flag. What was that?
Yes, this is absolutely crucial. Weight gain in a diabetic cat that is not well regulated should strongly suggest the possibility of acromegaly.
Gain, even when the diabetes isn't controlled.
Exactly, because the weight gain isn't due to an increase in body fat, but rather it's due to the increased mass of bone and soft tissue being driven by all that excess IGFI.
Ah, I see.
So if you have a diabetic cat who's eating a ton but is still putting on weight or even gaining weight, that's a really significant clue that acromegaly might be involved.
That's definitely something to file away. What about more visible physical changes? When might those start to become apparent to an owner?
These tend to become more noticeable as the disease progresses or, becomes more severe over time. You might start to see a broadening of the facial features,
Like how?
sometimes described as a more bulldog-like appearance. An underbite or prognathia inferior, that's where the lower jaw juts out further than the upper jaw that can develop.
Okay.
And of course, the increased paw size we mentioned earlier often becomes more obvious over time.
And it's not just what we can see on the outside, right? We talked about internal organ enlargement. What's the significance there?
Yeah, exactly. Organomegaly, the enlarged organs, is a common finding. The kidneys are often affected. That's bilateral renomegaly, meaning both kidneys get bigger.
Both. Okay.
And the liver, too, hepatomegaly. During a vet exam, you might also occasionally hear a heart murmur or maybe a gallop rhythm. Although, as we said, full-blown heart failure is pretty uncommon. Some cats might also develop lameness because of the bone and joint changes.
Right.
And in rarer cases, if that pituitary tumor grows significantly, it can even press on things and lead to neurological signs.
It sounds like there can be quite a variety of signs, but the sources also made a really interesting point about how challenging it can actually be to diagnose this sometimes. Why is that?
Yes, and this is really important for people to understand. Recent findings indicate that many acromegalic cats actually appear phenotypically indistinguishable from diabetic cats who don't have acromegaly.
So they just look like a regular diabetic cat.
Pretty much. They might just present with the typical signs of diabetes, making it really difficult to suspect the underlying growth hormone issue without digging deeper. It's almost as if acromegaly can be hiding in plain sight sometimes.
Okay, so if the outward signs can be so similar to regular diabetes, how do veterinarians go about, untangling the potential causes and considering other possibilities when they do suspect acromegaly?
Well, the first step is often recognizing that excessive growth hormone secretion is the primary suspect.
Right.
It's also crucial to rule out other conditions that can mimic some of the signs. For instance, while certain hormone treatments called progestins can cause increased growth hormone in dogs, the texts clearly state this is not a cause of acromegaly in cats, so that simplifies things a bit in felines.
Good to know that's off the table for cats. What other conditions might they need to differentiate acromegaly from?
Well, uncomplicated diabetes mellitus is obviously the main one.
Sure.
But they also need to consider diabetes that might be secondary to hyperadrenocorticism or Cushing's disease.
Cushing's. Okay.
And interestingly, both pituitary-dependent hyperadrenocorticism, PDH, and acromegaly can lead to insulin-resistant diabetes and the presence of a pituitary mass.
Oh, wow. So they can look really similar on imaging, too.
They can. And complicating matters further, they can even occur together in the same cat.
Seriously.
Yeah. So in those more complex cases, a test called a low-dose dexamethasone suppression test might be used to help rule out PDH.
Okay.
Vets would also want to consider other causes of, increased appetite, thirst, urination, maybe weight loss like hyperthyroidism.
Right.
Although those conditions don't typically involve the same level of glucose intolerance or insulin resistance.
So it sounds like that significant insulin resistance is really a key indicator that might point towards acromegaly in a diabetic cat. How resistant are we talking here typically?
The sources really highlight that insulin-resistant diabetes, meeting more than about 2.0 units of insulin per kilogram of body weight every 12 hours, is highly suggestive of acromegaly in cats.
2 units per kilo, that's quite a bit.
It is. And in fact, the insulin doses often need to be escalated significantly over time. Some cats require anywhere from 12 to even 50 units per cat every 12 hours.
50 units, wow.
Yeah, so that unexplained need for really high and often increasing insulin doses in a diabetic cat should definitely make a vet think about acromegaly as a potential underlying cause.
Okay, so we have the clinical signs, the suspicion based on marked insulin resistance. What do the actual lab tests typically show in a cat with acromegaly?
Well, routine blood work and urine analysis often show abnormalities you'd expect with poorly controlled diabetes anyway, things like high blood sugar, glucose in the urine, high fructosamine levels.
Standard diabetic picture.
Exactly. These are all expected findings in most acromegalic cats who are also diabetic. The text also mentioned hyperproteinemia, that's elevated protein in the blood. Traditionally, that was thought to be linked to kidney failure and hypertension, but some more recent research suggests this might not always be the case specifically in cats with acromegaly.
So the standard tests show poor control, but don't necessarily scream acromegaly. What are the more specific diagnostic tests then?
Right. The key specific tests focus on measuring the levels of those hormones we've been talking about. One very important test measures insulin-like growth factor I, or IGFI, levels in the blood.
IGFI again.
Yep. Now, it's important to remember that even diabetic cats without acromegaly can have somewhat higher IGFI levels than normal cats, so there can be a bit of overlap.
Okay, so it's not always black and white.
Not always in the borderline cases. However, dramatically elevated IGFI levels, the sources often mention a threshold, like exceeding 1,000 nanograms per milliliter, that is very strongly indicative of acromegaly.
Over 1,000. Got it.
And a big advantage of this test is that IGFI is pretty similar across different animal species, so reliable testing is readily available through many veterinary labs.
That's handy. What about directly measuring the growth hormone itself?
Yeah, measuring elevated basal serum growth hormone levels would absolutely be diagnostic for acromegaly.
I sense a butt coming.
You sense correctly. The challenge lies in the fact that growth hormone itself isn't as well conserved across species as IGFI is.
Ah, okay.
This means that a consistently reliable and readily available test, specifically validated for feline growth hormone, has had, let's say, limited availability in practice.
I see.
So while directly measuring GH would be ideal, in reality, measuring IGFI levels is often the more accessible and practical first-line diagnostic tool.
Okay, so blood tests, especially IGFI, can strongly suggest acromegaly. What about looking inside? What can imaging techniques tell us?
Imaging plays a huge role, both in confirming the diagnosis and letting us actually see the pituitary gland.
Right, to look for that tumor.
Exactly. Intracranial imaging of the brain area is essential to look for a pituitary mass lesion, which, as we've said, is the underlying cause in most cases.
MRI or CT?
Well, MRI, magnetic resonance imaging, is generally considered more sensitive than CT. Computed tomography, especially contrast-enhanced CT, for visualizing these often small tumors. But CT is often chosen in practice. It tends to be more cost-effective, more widely available, and it still usually provides good enough diagnostic information.
Makes sense. And imaging can reveal more than just the pituitary itself, can't it? You mentioned heart changes earlier.
Absolutely. Echocardiography, that's an ultrasound of the heart, might show findings like left atrial enlargement, maybe thickening of the heart muscle walls, sometimes abnormal movement of one of the heart valves, and signs of diastolic dysfunction, which affects how the heart relaxes between beats.
Okay.
And regular X-rays, or radiographs, can also show suggestive changes. Things like increased soft tissue density in the throat area, signs of degenerative joint disease with bony growths, maybe some spinal changes, and variable degrees of enlargement in the abdominal organs like the liver and kidneys.
So a lot of potential clues from imaging. Once a diagnosis of acromegaly is made, what are the options? How do you treat this in cats?
There are a few main approaches, really, each with its own pros and cons. Radiotherapy, or radiation treatment, is currently the only non-surgical method aimed at directly reducing the overproduction of growth hormone from that pituitary tumor.
Okay, radiation.
Yeah. However, it's generally thought to be better at shrinking the size of the tumor itself than at reliably normalizing the growth hormone secretion levels.
Ah, so it might help with pressure signs, but not always the hormone effects.
Kind of. There are typical radiation doses used, but some recent research suggests that a specific protocol using incremental lower doses given in multiple fractions over time might actually have better success in improving diabetic control in these cats. So the protocols are evolving.
Interesting. And what about surgery? The text mentioned hypophysectomy. That sounds pretty major.
It is a significant surgical undertaking, absolutely. But hypophysectomy, which is the surgical removal of the pituitary gland, is really considered the treatment of choice. It's the only consistently effective way to actually cure acromegaly in cats.
Like in humans.
Exactly. It mirrors its success in treating the condition in humans. But it definitely needs a highly experienced veterinary neurosurgeon and really careful management of the cat before, during, and after the surgery.
Delicate procedure, I imagine.
Very. The preferred surgical approach is usually transsphenoidal, which means going in through an incision in the soft palate at the back of the mouth to reach the pituitary.
Wow. What are the long-term implications for a cat that has its pituitary gland removed? Hormones must be affected, right?
Oh, absolutely. Long-term hormone supplementation is essential. These cats will need lifelong thyroid hormone and a glucocorticoid, like a synthetic cortisol.
Okay.
Interestingly, though, supplementation with synthetic ADH, that's the hormone that helps regulate water balance that can often be stopped after maybe 6 to 8 weeks following the surgery.
That's good news.
It is. And the major advantage of getting surgery done early is that it offers a realistic chance of achieving diabetic remission, often within just a couple of months after the procedure.
So, surgery offers the best shot at a cure. What about medications? Are there any drugs that work well for this in cats?
Yeah, that's the tricky part. Historically, medications like somatostatins and dopamine agonists, which are used in treating acromegaly in humans,
Uh-huh.
they haven't been very successful at consistently inhibiting growth hormone secretion in cats. They just don't seem to work as well.
Oh, okay.
However, there is a newer somatostatin analog called pasireotide.
Pasireotide.
Yeah, pasireotide. It has shown some initial promise in actually achieving this in cats. But, more research is definitely still needed to figure out the best way to use it, the right dose, how often to give it, potential long-term effects, all that stuff.
So something potentially on the horizon, but not quite standard yet.
Exactly. It's encouraging, but needs more study.
Okay. It's good to know there are emerging options, but what if, definitive treatment like surgery or even radiotherapy just isn't feasible for a particular cat or owner? What happens then?
Yeah, that's a common scenario. In those situations, the focus shifts to palliative treatment.
Meaning?
Meaning the goal is to optimize the management of the diabetes as best as possible and address any other concurrent health issues the cat might have, just to maintain quality of life.
Right.
Many cats with acromegaly managed this way will eventually need very high doses of insulin, like we talked about earlier. Sometimes even a combination of different types of insulin is needed to keep their blood sugar in a reasonable range.
So it's about managing the diabetes really intensely.
Pretty much. And while a complete recovery isn't possible without addressing the pituitary tumor, many cats can still maintain a good quality of life for, a decent amount of time with this kind of supportive care.
That's reassuring.
It is.
Okay.
Regular and probably quite frequent veterinary checkups are really important in these cases. And it's also crucial for owners to be super vigilant for the risk of low blood sugar, iatrogenic hypoglycemia.
Why is that risk higher?
Because of the fluctuating nature of the growth hormone secretion sometimes, and the ongoing, often unpredictable insulin resistance. It makes managing insulin therapy tricky.
Got it. Constant vigilance needed. And how do vets typically monitor the progress of cats with acromegaly, especially after treatment like radiation, or if they're just managing palliatively?
That's a good question. The typical clinical signs we often associate with poor diabetic control in regular diabetic cats, like that increased appetite.
Yeah.
Well, that might not reliably improve, even with good glucose regulation in acromegaly cats, because the growth hormone itself can drive appetite.
Ah, so you can't just rely on watching their appetite.
Exactly. Relying solely on those clinical signs isn't the most accurate way to monitor diabetic control here. Instead, monitoring blood glucose levels directly, maybe with home monitoring or curves, and measuring glycated proteins like fructosamine.
Okay.
That gives a more reliable assessment of how well the diabetes is actually being controlled.
And what about IGFI levels after treatment? Do they track improvement?
Interestingly, no. The
Uh-huh.
sources say that serum IGFI levels are generally not useful for monitoring the effectiveness of radiotherapy after treatment. They don't consistently correlate with how the tumor is responding.
Huh. Okay. Good to know. What about lifespan?
Survival times for cats with acromegaly can vary hugely, really widely reported from just a few months to, many years. And often the ultimate cause of death is actually due to other health issues that might be unrelated to the acromegaly itself, like kidney disease or maybe even complications from the diabetes.
So quite variable. To sort of bring it all together then, our deep dive into acromegaly in cats really shows it's this condition that's often tightly linked with diabetes, driven by too much growth hormone,
Yep.
and it leads to significant insulin resistance and this whole range of physical changes, some subtle, some pretty noticeable like the paws and face. It definitely needs a more in-depth diagnostic approach than just standard diabetes management.
Absolutely. I think the key takeaways for you listening should be, first, just how surprisingly common this link between acromegaly and diabetes might be in cats, especially when the diabetes is really tough to regulate.
Right, that insulin resistance is key.
Exactly.
Yeah.
And secondly, remember that counterintuitive sign. Weight gain in a poorly controlled diabetic cat is a major red flag.
Yeah.
It should definitely make you think about acromegaly. If you have a diabetic cat needing unusually high and especially escalating doses of insulin, it's absolutely a conversation worth having with your veterinarian.
Definitely. And that leaves us with this final thought to chew on. Considering how much the signs of acromegaly can overlap with just, regular diabetes, especially early on,
Hmm.
how many cases might actually be going undiagnosed out there?
Mm-hmm.
And what are the potential long-term consequences for those cats in terms of their overall health and how effective their treatment strategies really are? It really makes you think about the complexities that can hide underneath seemingly straightforward conditions.
It really does.
Thanks for joining us for this deep dive.